Thank you everyone for having us here. Thank you for the sages. We will be presenting a meta-analysis of 24,000 patients that underwent Roux-en-Y gastric bypass. So gastric bypass, Roux-en-Y gastric bypass has a very low complication rate. But although it has a very low complication rate, marginal ulcerations continue to be a relatively common prevalent condition compared to the other ones. So as risk factors, we have a lot of different things. Anatomical factors for the procedure. We have also as risk factors the use of drugs. And on the use of drugs side, NSAIDs are usually one of the most common drugs to be a risk factor. Aspirin is hypothesized to be a drug with higher rates of marginal ulcerations comparing to NSAIDs in general, because it may produce worse outcomes being a drug that can irreversibly inhibit COX. Our hypothesis, our objective is to compare patients that underwent Roux-en-Y and compare their rates of marginal ulcerations between those that used aspirin and those that did not use aspirin. So we evaluated our databases in 5 databases, and we ended up with 5,000 articles. Those articles passed to the PRISMA scope, and after the PRISMA, we removed the ones that did not match our inclusion and exclusion criteria, so editorials, secondary data, data that did not evaluate aspirin separately from other NSAIDs. Most of the articles were removed due to that criteria. We ended up with 3 articles that evaluated properly all of our criteria. So our data were based on observational studies. All of them were observational and retrospective. They were from Canada and from Sweden. And those studies evaluated the use of aspirin, but the diagnosis criteria were different between those studies. Some evaluated properly the use with diagnostic methods, and the other ones evaluated using billing codes. We evaluated the risk of bias using the Newcastle-Ottawa tool for observational studies, and our evaluation showed that 2 studies had a low risk of bias and 1 had a moderate risk of bias. After the evaluation with the Newcastle tool, we had 2 studies with a low risk of bias and 1 with a moderate risk of bias in our evaluation. We then pulled the incidence and also evaluated using a fixed effect model the odds ratio of aspirin use. Then we made a forest plot, and our forest plot showed that patients that used aspirin had higher rates of marginal ulceration when compared to patients that did not use. We also performed a funnel plot, and the funnel plot showed no asymmetry, although we know that the results can still be taken with consideration since we only had 3 studies. As discussion, we know that aspirin has a notable value as a therapeutic drug for avoiding cardiovascular events, but patients using aspirin may also require more attention after the Roux-en-Y procedure. Since patients with the use of aspirin had a higher rate of marginal ulceration, we are advocating that the high dose may be ideally held for most of the cases, but we know that further studies are still required to truly evaluate the effects of reducing the dose. Of course, a multidisciplinary approach is required to evaluate because most of those patients are using aspirin as a preventative drug for cardiovascular events. So we need a cardiovascular on our side and, of course, a multidisciplinary approach. Of course, we had a lot of limitations on our studies since we only had 3 studies included and all of them were retrospective and were observational. We had a moderate heterogeneity between our data that was assessed with I-squared, and we had a lack of data, since we did not evaluate, due to the lack of granularity, the effects of low dose versus high dose, the effects of pre-op use of aspirin comparing to post-op aspirin, and changing those doses between. So, of course, we know that we had a lot of limitations. In conclusion, we know that aspirin is associated with increased doses of marginal ulceration after Roux-en-Y gastric bypass. Thank you, everyone, for your attention.